To the Turn On Your Inner Light show. It's time to stop just surviving, and it's time to begin to thrive. It's time to live happier and healthier. Turn stress into strength. Noted author Debbie Mandel will show you how to move beyond personal doubts and fears and into positive perception to turn on your inner light. Here's your host, Debbie Mandel.
Greetings, everyone, and welcome to my show. Our guest expert is Arnold Melman, M.D. He is the chairman of the Department of Urology of the Albert Einstein School of Medicine and Montefiore Medical Center, and author of After Prostate Cancer. After the cancer recedes, the patient is often surprised by what recovery entails. Let's learn about all the treatments available for a better emotional and physical recovery. Welcome, Dr. Melman.
Pleasure to be here.
Now, there's a raging debate now about the new PSA guidelines. It's kind of equivalent to what was happening with the mammograms. What's your take on it?
I was so incensed by the negativity of these recommendations. I wrote a letter to the Times. I don't know if they'll publish it or not, but I think what they're recommending is that they're going to set back prostate cancer treatment to the pre-PSA days. And the people on the committee, on this task force, they're not urologists. They're pediatricians and epidemiologists and internists. So they have no idea of what it was like in the pre-PSA era when half of the men came in for treatment with metastatic disease that have cancer in their bones, in their lungs, in their liver. Their prostate screws, so the bladder was blocked. They got infections and bleeding. Tubes coming from the kidneys were obstructed. It was literally a nightmare because we did not have a way to make a proper diagnosis. And the PSA changed that in the late 80s. And I teach residents in my profession, and we have to talk about the historical way it used to be before PSA. Tell them the way it was, because we never see that, or rarely, maybe once a year, do we see a patient who comes in with metastatic disease as the primary presentation. So it's simply outrageous, absolutely outrageous, that to save money, which is, I think, the primary motivating factor, that we shouldn't do this. And as part of the reason that they suggest for doing it is they say, well, if you treat the disease, you can get complications. That's true, you can. Most of the people do not get complications. And one of the things we do in After Prostate Cancer is really talk about the complications and outline in several chapters about what you do about them. So people could lead very normal lives, even if they do have the complications. And most important is that they're alive and they can deal with the complications. So,
well, apropos to that, I'm going to share something with my audience. My brother-in-law just had his prostate removed. He had prostate cancer. His grandfather died of it, and my brother-in-law is an oncologist, and his philosophy is, when in doubt, take it out. He did not want to do radiation treatments or the radioactive seeds, because once you do that, it's a mush and a mess, and you can never use surgery. He said you can always radiate after surgery.
Correct.
So he said he's not going to live with this. He was advised by many doctors to do watchful waiting, slow growing, but when they ultimately removed it, it was pretty close to the colon, to the rectum, and it might have invaded. So for him, that's good.
How old is your brother?
70.
So watchful waiting is, which I really don't ascribe to, is a crapshoot. So if you like to play craps, you can say, well, maybe I'll die of something else before I die of prostate cancer. So if you're in good health, you're going to die of the prostate cancer. If you're not in good health and you have a bad heart, you have diabetes, you have stroke, well, then probably something else will kill you first. But people who have 70-year-old men who take care of their mother have good genes, and they should have a long life expectancy. So, 70 is kind of the borderline range, but unfortunately what's happening, I think, is that people in their 50s being recommended to have surveillance. That means you have to have frequent biopsies, you're constantly thinking about, will the disease come back? And I have to tell you that all the urologists were diagnosed with prostate cancer, they all get radical prostatectomies.
Interesting. I think I saw what it did to his mind, and since there was longevity in the family, you know, he had an aunt at 100, his
Right.
mother just passed away at 97.
Right.
He said that's not going to apply to me.
Good for him.
What was very interesting is that you wrote about the role of exercise, and I applaud you for that. And you gave very specific examples of pelvic floor exercises and Kegels. His surgeon asked him if he's a walker. He says, I will not touch you unless you walk a minimum of 3 miles a day, and you will have to do that during recovery. And that made all the difference.
Right. Well, he put himself in good physical condition so that his body tone was such that so he can withstand the rigors of anesthesia, and the surgery would help him recover faster. And the exercises we talked about in the treatment for stress urinary incontinence, we're talking about strengthening the pelvic floor, to strengthen the external sphincter, the skeletal muscle, the voluntary muscle that helps you control your urination. And it's kind of like weightlifting. You know, if you lift weights, you make your muscles bigger. If you do pelvic floor exercises, you make your sphincter larger, and you can control your urination better. So, you know, we have a chapter in After Prostate Cancer about urinary incontinence, chapter 5, and it's true that for 2 or 3 months after surgery, the people will leak urine if they cough or sneeze or they have a full bladder, until they kind of regain this external sphincter control. But the overall incontinence rate after surgery is about less than 10%. There's an urgency frequency after radiation. These are the kind of things that people, if they read the book and they know about in advance, they know they can deal with them, whatever treatment they have for their disease.
See, that's what I liked about the book. It sets you up for preparation. To me, stress management involves preparation. No one likes the unknown. But even with all that, and you touched a great deal on the emotional, and you advised caregivers and the female in the house how to deal with that, because my brother-in-law, an oncologist, did not take very well to wearing diapers. And he's only a few weeks post. I think he's about 6 weeks at this point, maybe not even, and he's doing so much better. But it was emotionally harrowing for him. And I said, you told your patients. He says, but now I'm the patient.
Right.
But we're going to commercial break, and we will return with Dr. Arnold Melman, author of After Prostate Cancer.
Now you can take Debbie Mandel home with you. Her book, Turn On Your Inner Life, Fitness for Body, Mind, and Soul, will help you decompress with healthy, positive, concrete solutions. Common life challenges are presented so that you can quickly find the help you need. Emotional tips, original meditations, and a fun and easy-to-follow fitness workout for each mindset. This revolutionary new method will help you rewire mind and body to take back your power. Get it on Amazon.
Are you overwhelmed with the burden of taking care of children, parents, or both? Are you taking care of everyone else except yourself? It's time to change your habits and re-energize. Debbie Mandel gives you an innovative and easy-to-follow program for good health and happiness. In her magical new book, Changing Habits, The Caregiver's Total Workout, Debbie Mandel shows you step-by-step how to find the optimal balance between giving and receiving and guides you to exercise and eat right to take care of yourself. What are you waiting for? Read Changing Habits and start training for your life. Life does not need to be a burden. Get Changing Habits, The Caregiver's Total Workout on Amazon.
You're listening to the Turn On Your Inner Life show. I'm your host, Debbie Mandel, and I'm speaking with Arnold Melman, MD, author of After Prostate Cancer. Now, let me ask you this. There are so many treatment options. How do you know which one to pick?
Good question. It depends upon the stage of the disease, how aggressive it is and where it is, how old the person is, what their medical conditions are like, how they feel about living with prostate cancer in them or not, where they live and who they have the opportunity to be treated by. You know, if you're living in the middle of northern Alaska, treatment might be different than if you're fortunate enough to live in New York City, where you have many very experienced people who can each give excellent treatment. So, and then I don't, in after prostate cancer, I don't recommend talking to other people who've been treated, because everyone's disease is a little bit different. So what we do recommend is discussing it with the man should discuss it with his wife, with some close relatives, maybe a good friend who doesn't have the disease, and kind of think about how they want to interact. I think really knowledge about what can happen with each of the treatments and how they could be dealt with makes it much easier to make a decision. And I think that's what helps people decide. Some people say they go to the doctor and the doctor says, this is what I think you should do, and the people accept that. Some people shop around and they may go to 10 different physicians, each of whom give them a different opinion. I think that drives most people crazy. So I think what I recommend is that people to go to someone that they trust, that they know is experienced, that they know are going to be there for them after the treatment, should they have a problem, and work together with that person to help choose the treatment and let them do it.
And I think you could talk to other patients and see how their recovery was. You wrote a lot about, the latest procedures, robotics, right, chopsticks, and that seems to be less damaging to the nerves, and you'd want to know how many your doctor has done.
Yes, well, I think that's what I implied before when I said you don't want to go to someone for treatment who's just out of his residency and has done 2 radical prostatectomies. You want to go to, or the same thing is true for radiation. You want to go to someone who's experienced, who's used to treating the disease, who has a long experience with treating patients. And I really emphasize it after prostate cancer, because this is a guide to recovery, that they have to be simpatico with the physician, because complications do occur. You want to make certain that you have a relationship with the person, that he or she will be there, and if there are complications, and help you, guide you through the complications, or down the road, should someone later on not respond to the treatment and they end up developing advancing disease, you want to make sure the person is there to help them during that time.
You mean a doctor with humanity.
Well, that's what I mean.
Well,
a lot of urologists and radiotherapists out there who do have humanity.
Yeah, we have to find them, and thankful to your book, we can see that. Let me ask you this. What would be some treatment options for someone with advanced prostate cancer? You write about that, stage 4.
Right. So for advanced prostate cancer, the treatment is to treat the metastatic disease, and the treatment for that today is with androgen deprivation therapy, which means an injection that takes away male hormone. Prostate cancer is the cancer cells are sensitive to the male hormone, testosterone, and if you take away that hormone, the cells stop growing and die. Not all of them. The problem is that not all of them do that. So we have a chapter on future therapies. So one of the future therapies and one of the advances that are occurring is that drugs are now being designed to treat people who are no longer hormonally responsive. And these newer drugs are for men whose PSA keeps going up even when they're receiving androgen deprivation therapy. So it's a very exciting time now in prostate cancer care because newer therapies are being developed that'll help men live a longer time.
Well, just the way they're doing with other cancers, there's inoculation therapy, right? And for women have the same issue with estrogen Okay. I find that prostate cancer and breast cancer have so many similarities.
Yes.
Concerning the sexual connotation and life-altering issues. With breast cancer, if it's not the aggressive kind, you can probably get away with a lumpectomy. Can you do that with the prostate?
You know, I was asked to review a few papers for medical journals about where people recommended it. I'm against that. The reason I'm against it is with the present technology, maybe it'll change in the future, but prostate cancer doesn't only arise in one area of the prostate. And so if you take out one lump, if there actually is a lump, it may be in other places, and I'm not in favor of that. I think if you're going through the process of removing the cancer, you should remove the entire prostate. And I'm against lumpectomy. I don't think it's valid for treating prostate cancer because it's called a multifocal cancer. Mm-hmm. It arises in different places in the prostate, and we don't have a good treatment to do lumpectomy of the prostate as yet.
As yet, right. Things are evolving, including, I guess, gene therapy, if you have a genetic inclination towards it. Is there any connection to diet? I mean, let's say every man is concerned about it. Are there things we can do to prevent? Always easier to prevent than to treat?
I don't think it's really been proven that what specific dietary factors will make a difference. Soy gets a lot of press. What is interesting is that people who lived in Asia, where they had a very low rate of prostate cancer, when they come to the United States, have the same rate as everyone else who was living in the United States. So clearly there's some dietary and environmental factors that make a difference. And people who live in northern Scandinavia, they have a higher rate of prostate cancer. But the highest rate in the world is in the American black population. So it's probably a combination of genetic factors and dietary factors. And I don't think no one has really proved what the specific factors are that make a difference. So I think in general...
Well, we will go to commercial break because I want to discuss vitamin E with you
okay.
and supplementation. We will return with Dr. Arnold Melman, author of After Prostate Cancer. Dear listeners, I'm excited to tell you about my new book, Addicted to Stress. This is a message you need to hear. Are you addicted to stress? Do you do it all while everyone depends on you? Where's all this pressure coming from? It is coming from inside you. This is why my publisher, John Wiley, asked me to write Addicted to Stress, a woman's 7-step program to reclaim joy and spontaneity in life. This fun-to-read book teaches proven strategies to reclaim your life, silence your inner critic, build a healthy body, and reframe your thoughts to change your life for the better. Dare to be happy without the guilt. Addicted to Stress is easy to get. It's available at Barnes & Noble and other fine bookstores everywhere. You can also buy it at Amazon and other online retailers. We're back with Dr. Melman. Now, multivitamins are really in the forefront now as something, I guess, implicated in causing premature death, first for women, right, multivitamins, and now vitamin E has been a no-no for a while, and lately in the news it could bring on prostate cancer. What are your feelings?
Well, I'm not sure. You know, vitamin E, if you take it in very high doses, normal doses can cause increased blood pressure and stroke. We used to use vitamin E to treat a different urologic disease, Peyronie's disease. I'm not sure. I don't have the background to say what its implication is in prostate cancer. You know, different vitamins and different foods get implicated. Suddenly there's a little wave of enthusiasm. They don't pan out. So I'm not sure what the...
Yeah, the study had 35,000 men, actually.
Yeah.
And they were receiving, and it was randomized, and to receive daily supplementation with vitamin E. And according to the Journal of the American Medical Association, where the study was published, there was an increased risk of prostate cancer. I guess the moral of the story, maybe across the board, is that people should eat and avoid vitamins. I mean, that's a...
No, I think I must say, I don't take vitamins. And,
me neither.
So I think the problem is, and I think this just also came out this week in the press, is that it's shown that people take, if they think if one vitamin is good, two are better, and that's where the deleterious effects occur. Mm-hmm. I think if one feels they must take vitamin, and that may be true. One of the things that we talk about in the chapter after prostate cancer in men who are on androgen deprivation therapy, it's very important that those men be on proper diet, not that they should not get obesity, they shouldn't let their blood pressure go up, they shouldn't eat foods that would cause them to have diabetes, early heart attack, and stroke. Now, this is a lot of the people who are treated go on to have what we call PSA relapse, and they may be treated with androgen deprivation therapy, and it's critical in those patients to be on good diet and proper exercise and proper regimen.
The way a menopausal woman might, who has metabolic syndrome, right? I mean, she might get diabetes, cardiovascular illnesses, so they're really facing what we all do. I guess being balanced, is that it?
Yes, well, they're equivalent. The androgen deprivation therapy causes men to get the metabolic syndrome. So that people have to fight against that. They increase exercise and proper diet.
And strength training, right? I think strength training is tantamount because unless, here's the thing, doesn't strength training raise testosterone levels?
I don't know that it raises testosterone, but it does. If you do strength training, what you do is you increase your muscle mass, and it's the skeletal muscle tissue that burns the largest amount of calories. So it's very important for people as they get older, and we're talking about an older group of men who have prostate cancer, to maintain their muscle mass, because that'll help them maintain their overall weight and overall fitness.
And I totally agree with you, because I think women should do the same. I think it's the fountain of youth. Well, thank you so much for being a wonderful guest, and I recommend not only men read this book, but women who are caregivers and teammates to guys after prostate cancer. We should all know about the disease and the options, the menu that it entails, and how to prevent. And you cover everything so well.
I'd like to add that it's available on Amazon and Barnes & Noble.
Oh, we know that.
Okay.
We're savvy. Be well.
All right, thanks.
Affirmation of the week. If your deadlines are self-imposed, no one will know if you don't meet them. And for the latest medical trends, a team of scientists has found that vitamin D plays an essential role in the body's fight against infections such as tuberculosis. Researchers found that the human immune system's ability to kill or inhibit the bacteria causing TB is dependent on having sufficient levels of vitamin D present. The finding could lead to a new treatment pathway. Getting women to meet the U.S. federal government's recommended level of moderate to vigorous physical activity remains a huge challenge. A large new study shows that where women live affects just how likely they are to exercise. Factors women consider is the area crime-ridden, and are there sidewalks. So I don't think women want to exercise in a crime-ridden area, especially with the sexual gropers that we've had in New York. Older patients who happen to have been taking cholesterol-lowering statin drugs when admitted to the hospital with serious head injuries were 76% more likely to survive than those not taking the drugs, according to the results of a Johns Hopkins study. That was interesting. Now, an international team of scientists led by researchers at McMaster's and McGill universities is attacking the belief that genes dictate your life. The researchers discovered the gene that is the strongest marker for heart disease can actually be modified, get a load of this, by generous amounts of fruit and raw vegetables. Well, another case for eating your veggies and fruits, 11 a day, 12 portions a day, maybe becoming even a vegan. Patients who take certain popular types of blood pressure medication once a day are able to achieve somewhat better control of their hypertension if they take their daily dose at bedtime, according to a new systematic review. And older women who take a daily vitamin supplement, even just a multivitamin, had an increased risk of dying of cardiovascular disease and cancer, according to a study published in the Archives of Internal Medicine. On a good note, recent research has found that blueberries may be effective in fighting a difficult-to-treat breast cancer. Wild blueberries have been hailed as an anti-aging food, too. And that's wild blueberries, not the cultivated kind. And you can get them frozen and toss them into cereal and a treat. They're relatively low calorie, and they seem to be packing a whole healthful benefits. Along with, it's fall season now, get your apple a day, and maybe go apple picking, make it an active experience. We come to the close of another show. I have an educational website, turnonyourinnerlight.com, totally free. Subscribe to my free newsletter, and you will get the latest radio show archived for your listening pleasure, along with all the rest. A fresh news, stress management article, and the health tips fully delineated, emailed directly to you from turnonyourinnerlight.com. Use the website as a health tool for fitness, wellness, and emotional happiness. Have a good week, and see you on the radio.